Hello and welcome. My name is Nikki Andrews, and thank you for joining my webinar on mHealth. Today we're going to be discussing what is mHealth, who could benefit from mHealth, and how you can use mHealth at your site. If you're new to mHealth, mHealth stands for Mobile Health, which is the use of mobile technologies to support the achievement of health outcomes. It includes phone, computers, and tablets. So in the past year, the pandemic has created a reality unlike anything we've experienced in years. Virtually every aspect of healthcare was affected. Thankfully, mHealth, which already existed, was able to be used. While the technology is not new, COVID did turn on mHealth like a light switch. During COVID, we found that remote patient monitoring using mHealth technologies for those individuals who are at risk of or have developed COVID-19 may have helped to alleviate some of the burden on the healthcare system. For those with mild symptoms, wearable trackers were able to track vitals such as their temperature, heart rate, and oxygen level. This in turn allowed for those with worsened symptoms to get the treatment they needed. It allowed for beds to free up in hospitals. But let's take some real life examples of how you can use mHealth at your site today. Let's say you have a high population of patients with uncontrolled hypertension. What we would do now is we would give these patients blood pressure cuffs. What this does is allow people to, one, be more active in their health by monitoring their blood pressure. Two, if you have people who are day workers, they now don't have to miss work to come in for appointments. They can track their blood pressure more consistently and more frequently and be more on top of their health needs. Therefore, it alleviates the use of running people to the ED. Now we find that people who are using monitors to track don't miss their appointments as much because they can have a virtual visit where they can show their provider their blood pressure cuff monitor and show the reading. This allows them to keep healthy, allows them to stay out of the ED, and allows for the provider to be in more contact with the patient. And mHealth benefits are just not about your patients. They can also be used for your providers. Things like clinical and diagnostic apps help to keep providers for like doing digital imaging. Also, providers can collect data on patients and view labs. They can evaluate. There's also productivity apps that help staff with internal communication, scheduling, charting, and dictation. This allows providers to spend more time doing what they love, seeing their patients. While we still have a lot of work to do regarding the digital divide, while we also have a lot of work to do regarding digital divide that also highlights the disparity in our healthcare system, we have made a lot of progress. I would love to help you make more. Please click on the tools right below this video where you can get more information and how you can incorporate mHealth into your practice. Thank you so much and have a wonderful day.